Dear listeners, I bring to you Star Bradbury, a subject matter expert on elder care and publisher of the book Successfully Navigating Your Parents' Senior Years. Please listen in to learn about the many key issues elders and caregivers face, as well as important information that you can find in her book. Thank you.
First of all, thank you for having me. I'm very appreciative of getting to know you and finding a fellow passionate advocate in the world of senior living and senior healthcare. Well, a little about myself. I have spent 24 years working in the field of senior living and senior healthcare. I come to it from a slightly different perspective, which is what drove me to write my book, which we'll talk about in a minute. But I've always had a passion and a love for older people. So people usually say, well, were you very close to your grandparents? And I was for the time I had with them. They passed away when I was pretty young. But I can tell you that I was looking for a career change many years ago. And I thought, well, what would I love? And part of that was I knew I liked to help people. And my first job was in assisted living. And I became an administrator of an assisted living facility, the healthcare administrator, and then also for a memory care facility.
Wow.
And so I had a lot of experience in what works and what doesn't work in the world of senior living, because I was firsthand experiencing that by running these facilities. And then I was offered a position with a fabulous life care community, also called a CCRC. Continuing Care Retirement Community. And I spent 18 years at that facility and learned what the advantages of many levels of care. And then I started a consulting business and decided that there were so many people out there I kept meeting, I know you can relate to this, who just were so confused and at a loss for how to help themselves or their aging parents, that I decided I had a passion and a mission to write my book. I know it's going to be backwards, but
no, we can see it. Yeah, we can see it.
I wasn't sure if they would reverse it or not. So I wrote my book, Successfully Navigating Your Parents' Senior Years, to help people make educated and informed decisions.
That is absolutely fantastic. Thank you, first of all, for your dedication, your commitment to an underserved community, an underserved population. As I'm talking to experts in the field like yourself, and I think that what's enriching about your background is that you have actually served in these capacities and sort of overseeing these different facilities that provide services for elders and also for writing your book. And the need is so immense. It's so great. The magnitude. I could handpick anywhere I go where people are making ill-informed decisions and just really in the dark about.
Well, you know what really opened my eyes about this? That I did a tour when I was working at the life care community with a cardiologist who was touring the facility for his parents.
Okay.
And he was great at asking questions. But I realized that you could even be, as well, a doctor who really don't make the assumption that because somebody's a doctor or educated in one field, that they're going to know anything about the difference between assisted living and memory care, much less assisted living or skilled nursing or even a life care community. It's an education in and of itself. And what I realized is unless you take it upon yourself to educate yourself about what are the important questions to ask? How would I even evaluate an assisted living facility? And first of all, what do they offer? What kind of services? So many people are confused. They don't know that there are actually lots and lots of options out there in the world of senior living. And you have to be careful. You can find good facilities, but you just don't know what you don't know. How can you make a decision if you don't even know what they are?
Brilliant. Brilliant, Star. And you know what? I think that's the thing that I struggle with, because I think, as you just articulated, you could be a cardiologist. You can be highly educated, but and there's so much nuance to even selecting or knowing the difference between assisted living and are they appropriate for assisted living versus rehab. versus nursing home.
Absolutely.
And within these spaces, there's also nuance to it as well.
Absolutely.
Coverage.
I mean, like, one critical question that you might ask that you wouldn't even know to ask is before, I'll just throw this out there. It's a little
Sure.
bit out of context, but, and in my book, I have an entire chapter on what is assisted living,
Mm-hmm. Mm-hmm.
how do they evaluate who they will accept or not accept. In fact, you'll laugh at this, but my younger son suggested that I do TikTok. And I said, "Oh, Jake, I what do I know about TikTok?" He said, "Mom, didn't you write the book to help adult children who are coping with aging parents or might be in the sandwich generation where they're still raising children and trying to
Yes.
save for college and their own retirement, and then they have aging parents who may or may not be
Mm-hmm.
financially
Mm-hmm.
prepared to provide care for themselves or
Mm-hmm.
pay for that care?" I said, "Yes, yes, that is exactly who I wrote the book for." He said, "Well, then you should do TikTok." So I just did a TikTok video on what is the difference between assisted living and memory care, and another one was, who will assisted living accept or not accept? Remember,
Wow.
it's up to the facility to decide if they will accept your loved one based on all kinds of criteria that they don't make up. There's licensing requirements. They either meet that requirement or they don't. Maybe they need more care than they're allowed to take. But again, you said it perfectly. These are the nuances that people just don't know to ask. And so I spent a lot of time based on my expertise, which is not the medical side, but from all my years of managing as an administrator, assisted living, not
Mm-hmm.
skilled, but
Mm-hmm.
assisted living, memory care, and then a life care community. That is the experience I put in the book. What is assisted living? What is skilled nursing? What's the difference between home care and home health care? It is so confusing that my heart goes out to people trying to figure out where to even begin.
Mm-hmm. 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 Now, so let's talk about that. Let's talk about the difference between home care and you said home health.
Right.
Yeah. So please share with us.
I'd be happy to.
Yeah.
And especially since the terms are often used incorrectly and interchangeably.
Yes.
So home care is really what I like to call companion care, meaning that when you are reaching out to a home care company, you are really finding somebody who can come and help your loved one. It could be your mom, dad, your auntie, anybody. Let's just say loved one, to provide some support. For example, they might help make meals, meal preparation, light housekeeping. They might assist while you're taking a bath or even help
Okay.
you with some simple home chores, or as some will drive you to the doctor or take you
Okay.
grocery shopping.
Mm-hmm.
Now, I haven't mentioned one thing that falls under the heading of RN, LPN, or nursing. It's a companion. They could
Okay.
provide socialization, interaction, another pair of eyes to see how things are going.
Okay.
And so, and so I am guessing that many of your listeners or viewers are thinking, "Oh, I get it," because I could see that if my loved one had that kind of support
Yes.
2 mornings a week or 3 or 4 or every day, depending on their need, that would make a huge difference to know that somebody was there helping them with preparing a meal, cleaning up after that meal. Let's start a laundry,
Mm-hmm.
changing linens. That's a companion, and they can be called different things. Home health aide.
Okay.
It could be a CNA, certified nursing assistant, but would not have to be.
Right.
And these are people who are more helpers,
Supporters,
companions,
right? Mm-hmm.
supporters.
Yeah.
And that I will tell you that the cost for that in my area in Florida has certainly gone up significantly, as it probably has nationally. Well, I know it has after COVID,
Yes. Yes.
about 25 an hour. And that's through an agency, a home companion agency, not home
Got it.
health, home care. So when you're calling, there's all kinds of questions I list in the book that you should ask to vet these companies. Make
Okay.
sure you're hiring the right company.
Okay.
And it takes time. Don't just open the phone book. I say that nobody does that anymore.
Right. Yes. Yeah.
But
Yeah.
don't just, call anybody. Do some homework and
Right.
vet that company, because remember, you're inviting that person into your home or into your parents' home,
Right.
where you should
Yes.
be concerned about identity theft and security and
Yes. Yes.
safety. So I can't minimize that, but you
Yes.
can find people who can provide that support. Now, the tricky thing that I'll share with you
Uh-huh.
is that these agencies have requirements, most of them, for a minimum number of hours and days per week, or they won't even take the job.
Okay.
So, what typically
Uh-huh.
that's going to be at least 4 days a week, 3 hours a day. So
Okay.
there's no like, could you stop in for an hour? No, not unless you hire privately. You find someone on your own. Again, vetting's even more important
Right.
to come in and help. But most agencies now, why do they require that? Because they're trying to have a stable workforce who needs full-time work. So
Mm-hmm.
I understand their need they can't patchwork a million jobs, 2 hours here, 2 hours there. So to be a reputable company with a stable workforce, they have to set these kind of requirements. So that's what you can expect. And if you're in New York or California or DC area, New Jersey, I'm positive it's remember now, this is a companion, not a nurse.
Right.
25, 30 an hour with minimum requirements to even take the job.
Wow. Wow. And what is home health?
Thank you. Let's get back to that. So, home
Yes.
health. Your listeners will be far more familiar with that, Harlem, because home health are the people that are going to come into your home post surgery, post hospital stay, and provide physical therapy, occupational therapy,
Okay.
speech therapy, wound care, follow up when you're home. You've been discharged
Right.
from the hospital or maybe even rehab,
Uh-huh.
but that your doctor writes a script, well, typically,
Yes.
for
Yes.
that continuing care at home,
Right.
provided by a trained therapist or an RN and LPN to follow up with you for a limited amount of time,
Time. Yes. Yeah.
under which Medicare would typically pay
Okay.
most of those costs.
Okay.
Now, let's say you need that level of care,
Uh-huh.
but you're not post hospital.
Right.
You can privately hire anytime you want. They'd be happy to take that job where you're private paying a nurse, an RN, or a therapist. And that doesn't happen that often. Most of the home health companies are providing care based on a doctor's prescription for a specific patient for post event, usually a hospital stay, and where years ago, it's sort of the typical scenario changed. You go to the hospital to get hip surgery. It's practically outpatient.
Yes. Now.
You're
Yes.
not
You're right.
going to rehab. You're getting
Yes.
rehab in your home through that physical therapist or occupational therapist. But I can't stress enough the importance of that. Do
Yes.
not minimize the importance of getting that PT and OT post fall, post stroke, post orthopedic surgery if you want to recover your independence. And
Yes.
I have personally had hip surgery. I'm an old
Yeah.
dancer and danced for all my life. And I can tell you that I privately paid for continued PT after my Medicare days ran out,
Mm-hmm.
because I knew I would still benefit. It was
Mm-hmm.
worth it to me to go back to my complete optimal mobility.
Wow.
So I
Worth
just want
it.
to remind you can do that,
Mm-hmm.
but
Mm-hmm.
most of the time, home health is covered under Medicare and your supplemental insurance for rehab after an event.
So, in my podcast, in this project, we look at clients, elders, family caregivers of different sort of the socioeconomic strata, right? Low income, middle income, high income. And as I'm listening to you, the first question that comes to mind is coverage for home care and home health. And I wonder, do you know in your book, did you cover where Medicare covers for that? Uh,
Great question.
uh-huh.
I find myself saying sadly, Medicare is not going to cover home companion care.
Oh, really?
No, mm-mm. I mean, as in never.
Wow,
So, yeah,
really?
Medicare, no, if you are hiring a supportive person now to keep your loved one at home, safe and at home, because let's face it, the majority of people want to stay in their home for as long as possible.
Yes.
And let me remind your listeners that if you have a resistive parent who's saying, I don't need any care, I'm fine, I don't need any help, but clearly you see otherwise, you
Yes.
clearly see that that is not the case. I have a whole discussion in the book about how do you have a conversation with a resistive parent who you know would do so much better with a little help. I don't want to go off track. We can remind me to circle back to that.
Sure.
But back to your question is who pays? Well, for home care, it's coming out of your pocket. For home health care, meaning nursing level care, which you don't need a nurse to help you bathe, or
Right.
to assist you
Right.
in. You don't need a nurse to make you a sandwich. They're
Mhm.
so you don't need home health care. You only need home health care where there's a real need.
A medical
And
need. Mhm.
yes, a medical need. And the majority of that would be covered either by Medicare, probably part of your supplemental might cover that. If again, if it's doctor's orders, doctor's script, but at some point you're going to run out. I'm not a Medicare expert, but there's X number of days, or there's an amount that's allotted to you in terms of using up your PT, physical therapy, occupational therapy dollars. And then at some point they're going to say but it's a healthy amount for a post surgical event. But
Mhm.
after
Mhm.
that, you have the option of paying privately. And I'm less familiar, to be honest, with Medicaid.
Mhm.
But again, if the need is high and you're already in the Medicaid system, I do believe that doesn't mean your doctor won't write a script or put you in rehab if that's the best way for you to recover from your surgery or your fall or whatever.
I'm happy you brought up Medicaid because there are several sort of misunderstanding about Medicaid. But before we go into Medicaid, this issue comes up a lot, and you've sort of touched on this several times. That relationship between the patient, the elder, and their provider, or the elder's kids and their provider. And the
Oh,
issue, that the legal issue also comes to hand where there should be a need for a power of attorney
absolutely.
when the elder cannot make that decision. But I can't tell you how much I've heard where there's a disconnect when the families are not really in contact with not just their primary care provider, but the specialists also involved in the care of the elder parent or the elder, you
They
know?
don't even know who that is or that
Yeah.
their parents even have special.
Yes.
Yeah. I haven't, I mean, you are really hitting a hot button for me because when I decided to write the book, Harlem,
Yes.
I had, in working in senior living and having many of the residents at the life care community I worked were my friends and still are. And they were like, well, write the book for us,
Yeah.
and then I had somebody say something really that changed my mind. And they said, Star, I can tell you that when my mother started going sliding and needing more help, and
Yes.
needing more care, I had no idea what I was doing. I had no idea what to do. And I really struggled for years trying to make decisions and feel like I was failing her and failing myself. And I didn't live near her, as so many adult
Uh-huh.
children are long distance caregivers.
Yes.
Please write the book for us. Write the book for the adult children. We're worse off than our parents. They've had at least some more life experience. We don't know what we're doing.
Yes.
So I did. That's why it's successfully navigating your parents' years. Although I will tell you that probably 50% of the readers are older people themselves who are reading the book and extrapolating that information for themselves. But I just see how difficult it is to make these decisions, Harlem, and to feel confident in your decisions. And one of the things I addressed, I have the 5 pillars of aging successfully. Here's my little cheat sheet here.
Uh-huh.
And one of those, and I'll run through them real quickly because
Sure.
it
Yeah.
addresses
Absolutely.
your
Yeah.
question.
Yeah.
One is, and this is a question that you can ask yourself or have a discussion with your parents long before they actually retire. Do
Mm-hmm.
I want to age in place or move? And if I want to move, meaning I'm the elder, I'm looking ahead, trying to make a plan to age successfully, but that takes planning. Should I age in place in my home? Am I in a 2-story home where all the bathrooms and bedrooms are upstairs? Will
Right.
that work out very well as I age? Probably not.
Right.
Am I in a rural area, half an hour away, an hour away from
Mm-hmm.
a really good hospital or a doctor? What if I can't drive? Nobody wants to ask themselves these questions, but I have a whole list of questions and a chapter on
Wow.
is that a good plan? So when people tell me, oh, I'm never leaving my house, I'm aging in place, they don't say that, but that's the industry term.
Yes. Yes.
I'm staying in my home. I generally say, great, what's your plan? How
Mm-hmm.
strong is your support team?
Mm-hmm.
Because just saying that you want to stay in your home is not a plan. That's just a statement. So there are
Correct.
many, many things that go into making a plan that will work for you and help you stay independent for as long as possible. So that's pillar number 1. But pillar number 2 is critical medical documents. And 3 are legal and financial documents, which circles back to your question. Have you appointed a power of attorney? And is that person willing, able, and capable to step into that role and help you make educated and informed decisions if the time should come where you're no longer able to do that? Talk about confusion. People tell me all the time that they think power of attorney exceeds or death. And the answer is no. Power of attorney gives you the authority to make decisions when that person is still alive.
Right.
That
Yes.
doesn't mean you're the executor or personal representative of their trust or will. It's only to make decisions when the person is still alive but no longer able to make those decisions for themselves. So you can
Wow.
see how critical that is. And under critical medical documents, I have pages of lists. For example, who's your parent's primary physician? What's
Mm-hmm.
their phone number? What's their email? Do they have a social worker or geriatric care manager on staff, as some doctors are starting to do now, so their patients don't fall through the cracks? Someone besides the doctor. Do you think you're going to get the doctor on the phone during regular office hours? Absolutely not.
Right. Right.
So who else in their office functions in that capacity to be the liaison, to communicate? Because a lot of doctors are adding people in that capacity now. So there's
Mm-hmm.
a long list of information that you can get ahead of a crisis that would put you in a much better position to make informed decisions and really be of help and service to your loved one.
Yeah, well, this is absolutely fantastic, Star, and I could see where you are the ideal person to write that book and to have written that book. And I guess I'm going off on a tangent here a little bit, but like now that the book is written, how do we get it to the folks out there?
Happily, it's on Amazon, Books A Million,
Yeah.
Barnes and Noble. And it's about $16-17 on Amazon. That's a sale price. If I have had, interestingly enough, elder law attorneys, people, home care companies buy the book in bulk to give it to their families, to educate them, to give it to their clients, to help them make better decisions, because it's unique in that my perspective comes from my years of working in senior living.
Absolutely.
And usually, most of the people that have written books, excellent books, are more as caregivers, as opposed to, listen, not everybody can be a caregiver.
Correct.
They may not even live in the same state.
Right.
They can't quit their jobs and move their family. And so then what? How can you do long distance caregiving? What can you do to be prepared for the inevitable crisis? And so the book is out there, and people, if they were interested in buying it in bulk, they should contact me, because I can work with the publisher and offer much steeper discount. But listen, it's the best $16 anybody could invest, because it has so much information to guide you in making educated decisions.
Fantastic. Fantastic. And we were talking about Medicare and you mentioned Medicaid. And I know that a lot of families, families, well-to-do families, families who are struggling, may not know that they have Medicaid as an option. Did you also
Oh,
discuss that in your book?
yes, I do talk about that, but I'm so glad you brought that up because there's so many misconceptions about Medicaid,
Yes.
and people don't realize that Medicaid is not only for people who are poor. Medicaid is, if done correctly, done through a legal process of talking to somebody who's either a Medicaid application expert
Uh-huh.
or an elder law attorney.
Yes.
And for example, you might say, well, I'll never qualify. I own a home, but I'm terrified because my husband has dementia and I can't take care of him anymore. And I'm going to have to put him in memory care, which, by the way, is going to be, I'll just say, an average of 6 to 8 thousand a month.
Wow.
That is not
Wow.
very far off.
Right.
And I'm worried that if I pay for him and he passes away, I'm not going to have any money left. I hear
Right.
this all the time, either from,
Okay.
often from the wife, but it could
Uh-huh.
be the opposite.
Right.
And so people make assumptions about what they should do and act irrationally, sell the house. Don't do any of that. Go see a Medicaid expert, because
Okay.
once you put it, if you try to do your own application,
Uh-huh.
I will tell you that if it's rejected, you can't reapply for, I think it's 2 years. Don't
Really?
quote me on that, but I'm almost positive. Yes. And so you
Wow.
can't afford to say, oh, I made a mistake. Just send it back to me and I'll reapply. It doesn't work that way.
Mm.
And it's complicated. I would tell anybody, don't do your own Medicaid application unless you're being assisted through US Aging, Elder Options, through the national agencies that are helping you get qualified, but they can't walk you step by step through the application
Different
process, which
process. Yeah.
takes months and months and
Yeah.
months.
Yeah.
You can get on a list, but if you really want to make a successful plan, then you need to look at what can you do, because there's a certain trust you can set up that are legal to put
Okay.
some of your assets in that trust, that then you don't own those assets. Those are owned by the trust, and that protects some of that money so that you're not going to be impoverished if you're having to pay for your spouse's long-term care in a facility that's expensive.
Mm-hmm.
Don't make assumptions. Educate yourself.
Yeah, so that's actually I've never heard the term Medicaid expert. Yeah, so they do exist.
Absolutely.
Yeah.
And often they're elder law attorneys, but for those of you who may say, I can't afford an attorney, I would reach out to many, many cities and towns, even a mid-sized city like where I live, have legal services that are funded under Department of Elder Affairs and through federal grants and through federal funding to offer free legal advice. Well, you could start there, but if you go to the website US Aging,
Okay.
capital US
Uh-huh.
aging.com or
Okay.
.org, okay,
Uh-huh.
and it goes by different names in different towns. For example, where I live, it's Elder Options. And that, again, you could check within your state and they go by different names, Department of Elder Affairs. And I would start with whatever your department is called within the state you live in that provides services for seniors. But you can go on usaging.org and put in your zip code, put in your state, your town, and see what resources are available for free to guide you on that path. And there are also other people who are Medicaid application specialists. That's their business,
Wow.
because and they're going to be less than an attorney.
Right.
Dollars well invested.
Right.
And don't wait for the crisis. Unless you have endless pocketbook,
Right.
you could be, like you said, middle income, middle class.
Right.
And the fastest growing bankruptcies in the United States, Harlem, are people going bankrupt from medical bills and long-term care bills. And
Wow.
and so if you say, even if your parents are modest or middle to upper middle class means. Just imagine if you were paying 7,000 a month for assisted living or memory care and skilled nursing. Don't even talk if you were private pay at the facility at the life care community I worked in. A private room in skilled nursing is over 14,000 a month.
Wow.
A month. And in my 5 pillars of aging successfully under critical medical, legal, and financial documents, the 4th one is how will I pay for long-term care should I need it?
Wow.
And people don't, and you can't suddenly save that kind of money.
Right. I mean, and it goes by like this. Before you know it, $100,000 of your life that you saved for 40 years goes by in one year.
Just divide 100,000 by 14,000 a month.
That is insane.
Now that was a private room. But if you said, well, Star, what's the average cost of skilled nursing? First of all, that would be a semi-private room. And I'm going to say probably 8 to 10,000 a month. And all of those costs are going up an average of 5% a year. So I want to tell your podcast fans about another resource that I love.
Sure.